Hey guys, Don here. Welcome to Podiatry Practice Mastery. I want to go over today. I was testing something out in the office yesterday. I wanted to figure out if there's kind of a little bit easier way of having patients do online reviews. And I know there's a nice product out there. It's called Weave. Many of you may use it. It does two things really well. One is it fills in your open slots by sending kind of a mass text message to everyone that's on the wait list, and it can fill in some of those slots pretty easy. That's the first thing. I think they kind of hijack your phones too. I think they take over all your phone system as well. But another neat thing is when patients are leaving, it sends them right there a text message that they can do an online review. And we certainly have a lot of reviews, but I was wondering, well, how can I improve the review rate and kind of see what the bug is with the reviews? So currently, we get them when people make an online appointment with our website, which is Patient Pop, and it sends them an email afterwards to do a review. But a little quicker way of doing it is we use something called Patient Education Genius. So every patient that comes in, I send them patient education information. It might be a link to one of my blog articles. It might be a link to a video or something else like that. I've talked about that before. But what I can do, and while they're in the treatment room, so this is something, it's kind of to the next level, because you want to make sure patients are getting this stuff. So I'll send them the information right when I'm there with them. So basically, I'm going to send you this information, Mrs. Jones, in either email or text, which one you prefer. I have them actually take their device. I have them open it up so I can show them around the Patient Education Genius, the information there. But more importantly, there's a place that they can do a review right there. And I realized one of the kind of the things, the wrenches in the wheel, is when I do that for patients, if they don't know or they're not auto logged into their Google account, they can't leave a Google review. And everything is about Google reviews. And only people with Gmail accounts can do Google reviews, just so you know. So they need some type of a Google account to do that. And so I would send them, everyone now is being sent to Google. And like the two patients that I tried this on yesterday, they didn't have auto login to Google. So if there is a hiccup in that step, they're not going to leave a review. So what I did is I sat down with them, and I had, well, could you remember it? Can you put it in there? And they couldn't. So what I did is I sent them another link to Health Grades, which is another online review option as well. So you could send them to a number of other ones as well. So it's neat when you do it in the treatment room. And then one person did get in, and then I just said, well, you can just take a few more minutes, and why don't you just write your review right now so you can get it done with. I think people like to get things done with quick. So this is kind of a neat option for them to do that. They do it on their own device, and they can write the review right there. Now, both of these, I want to mind you, were patients that I had good relationships with, that I could do this, that wasn't just their first visit in the office. These were people that, it wasn't an awkward moment asking them for a review. I think if you do it, and they can do it right when they're in the treatment room, it's a lot quicker for them, and they just kind of one thing checked off the list. If you give them a number of things that they should do, a lot of times they won't do it. I'm trying to think of what's the other thing that people could do with their devices? Because I think people are so used to being on their devices and like to use their devices so much. My next step would be, as I'm treating people for conditions, for example, plantar fasciitis. Currently, I bring in my iPad or the Samsung Pad, and I have them watch a little 5 or 10 minute video on plantar fasciitis with my iPad. Well, why couldn't I just as easily send them the link right there? They open up the link on their device, and they can watch that little 5 or 10 minute video while I go see another patient, and then I come back to see them. Okay, so it kind of occupies them with my own resources versus giving them my own device to use. So just another way, as long as you have good internet where you're at, and patients can get those messages. I know some places, one of our old clinics, it was all made out of concrete, and they couldn't get any cell phone reception in there. So you'd need cell phone reception. But just another way of getting online reviews is kind of an elegant way. Do it right when they're in the office. I know there's a couple of other things that they can do that, but have them stay a couple of extra minutes in there and do the review right then, and then you can get that. Okay? Once again, I hope this is beneficial. I've been adding more things to the membership site on Podiatry Practice Mastery. So if you go on there this week, I was actually adding stuff on Shockwave. So if you do Shockwave or EPAT and you want more information, I've taken some of the interviews off of Podiatry Practice Mastery, which is the present site where I've published the interviews, and I've actually put them on this membership site just so you can find it based on category. So I've put the category of Shockwave there, a couple of interviews that I've done, a couple of other useful websites. So if you want to improve your Shockwave, if you want to do more numbers, get more tips, things like that, I would recommend going there and doing this, and it's really worth your time. And if you want, just kind of do a little shout out for Paul. If you really want to take it to the next level, Paul Hobro from England, he has a Shockwave course. So basically, he does mentoring. So if you really want to get better at the business behind Shockwave and how he does things and just does gangbusters with Shockwaves and helps practices do it more, I would go and have a consult with Paul. You'd find yourself beneficial. And really, if you think about it, like just with Shockwave currently, if it's, let's say it's $500 a month, what he charges or something like that. So how many Shockwaves is that? That's like 3 Shockwaves in a month. If you can increase your number by 3 per month, there's something wrong. So you should be able to maybe do it 10 times that, as long as you have the numbers or availability in your schedule. So just a kind of a shout out to Paul. He does some great work, and great. We'll talk to you guys later. Have a great day.